event, the traumatizing event. It's not always an obvious event, sadly. In situations of complex trauma where there are multiple situations, or if the event occurred over the course of years, this can be rather challenging to understand exactly what is the traumatizing event.
And can you give us an example of what that could be? I mean, we can all picture, a roadside bomb exploding or some kind of a terrorist attack. But what are you getting at? What is that?
Sure. For example, a woman living with an emotionally abusive man for years. Mm-hmm. Coming into treatment because of a recent episode of physical abuse.
I see.
The low-hanging fruit, so to speak, would be to look at the physical abuse as the traumatizing event. But it could very well be something that happened earlier, possibly even before that relationship began, that laid the initial groundwork for the trauma, and then having a relationship with an emotionally abusive man reinforced an already existing mindset.
A mindset which was created when? In her early years and in childhood? Or
Very possibly, yes. That happens oftentimes when we do a exercise called a float back, which is we'll assess them, understand what it is their problem is right now, mm-hmm. and then we'll talk about the rest of their life, kind of like hitting the rewind button on a movie to kind of look for evidence of the same sort of thing earlier in their world. Typically, we can find it in cases of complex trauma, and it's often in childhood.
I mean, it may be that someone who has had exposure to a trauma or this chronic trauma you're describing, that person may not actually develop symptoms of post-traumatic stress disorder. Isn't that right?
Right.
And so what makes the difference between someone who does get PTSD and someone who doesn't, both who were exposed to the same either exact trauma or kind of trauma? What do you think makes that difference?
That's a really good question. There have been studies to try to understand that. And the greatest thing that helps a person be resilient is what you're really looking for. The greatest resiliency tool, the greatest thing that a person can possess to help them recover from a traumatizing event is a strong relationship with a safe person. And remarkably, it doesn't even need to be an important relationship. In the cases of kids and teenagers, it could be a school teacher that simply has convinced that child that they are safe and that they can have discussions and that when they're with them, they can be okay. And it helps them to fine-tune that antenna that allows them to get updated information about the world, telling them that they're safe. So strong relationship with at least one individual seems to be the greatest tool that a person can have.
Mm. And, the nature of the trauma could change. I mean, it must. It must change physically and emotionally the person's response to stress going forward in their life.
Absolutely. In fact, that's what EMDR is considered a body-centered therapy. And perhaps I should explain a little bit about what EMDR is, because it sounds a bit mystical. A lot of people come into my office and ask me if I do that hypnotizing thing where I waggle my finger in front of their face, and that's not at all what EMDR is. The eye movement part of EMDR is simply what we refer to as bilateral stimulation. Essentially, we are mimicking the act of REM sleep. People have very vivid dreams, and they have very vivid dreams because both hemispheres of their brain are actively involved in recalling something. And the eye movement is just evidence of both hemispheres being active. We kind of reverse engineer that. With EMDR, we simulate the bilateral stimulation either through eye movement.
Bilateral stimulation, you mean both sides of your body is stimulated?
Both sides of the brain, but we'll use the body as a tool to do that. For example, we'll have them rapidly move their eyes back and forth. We'll do a thing we call tapping. We'll literally tap the back of their hands one after the other in a rhythmic pattern. We have palm buzzers, which will buzz left then right, then left then right. Or perhaps they'll use headphones, and it'll beep right ear, left ear, right ear, left ear. And we do this bilateral stimulation while we are asking them to recall their trauma, and we'll ask a very scripted list of questions to help them do that. And the idea is to elicit this trauma memory while, and at the same time, and this is the important part, while they are grounded and their antenna is well-tuned. And that's always the first part of EMDR, is making sure that antenna is well-tuned, because without a well-tuned antenna, without that updated, safe information,
Yes.
we're just re-traumatizing them.
Yes. So in other words, you couldn't do this kind of work if somebody is really unstable in some way.
Exactly. If they don't have their antenna well-tuned, then they're not a candidate for EMDR.
And so basically what you're saying is that you're almost trying to pretend, in a sense, that you're dreaming. You're recapitulating REM sleep. Is that true to say?
Well, the dreaming is only just one evidence of what we see in how a brain works when it's working well. That's evidence of the brain processing effectively. And so, yes, in a way, we're trying to recreate that ultimate optimal level of neural functioning. That we're trying to tune the person's brain to being able to process very, very complex traumatic information the way it would normally. See, our brains, we already have a way of processing information. We do not have an effective way of processing traumatic information. So we don't need to reinvent the wheel. We just need to tune the brain better so that it can process this more traumatically loaded information.
Why do you think these memories and these whole body memories get stuck in a sense?
Good question. And the way I understand it, I'm not a neurologist, but the way I understand it is PTSD is a normal response to an abnormal situation. We are wired this way, to be cerebral, to think, and to process data in our brain is a relatively complex process. And in situations where we might be harmed or killed, we really don't have the time. And so in the course of human development, we came up with a shortcut where if we're presented with potentially fatal situations, that entire situation, completely unprocessed, gets encoded, gets stored like a videotape. And it gets stored in a very special place in our very brain so that we don't have to think about it. We just know we're not safe.
Some young child is about to cross a busy street. You, as an onlooker, see this happening just a few feet in front of you. You grab the child. The child isn't even yours. You grab the child out of harm's way, bring him back to the sidewalk. Only 5 minutes later do you notice that you cut your leg on a no parking sign or something. You felt none of that. Something else took over. Your amygdala, some part of your brain. Tell us about some of that.
Right. Essentially, you're describing what a neurologist would probably refer to as the sympathetic response, sympathetic nervous system, which is, it's the fight or flight part of us. If we need to act instantly, there's a mechanism in our brain and that will cue us up, that will bypass all the unnecessary information, all the unnecessary data that our brain is processing and go straight into act. And one of the things that gets shut down is those sensory neurons, the part of our brain that tells us we're in pain.
Yeah.
They're not useful in those situations. In fact, they're a hindrance.
And yet the same person could that night, the next night, there might be recurring nightmares developing. And now, granted, this may be not quite post-traumatic stress. Might be acute stress. But regardless, something may actually stay with this person. And they wake up the next day, the next month, the next year, and they see young children playing on the sidewalk, and they are struck by this feeling that they've never had before. But it's this feeling that has occurred since they rescued that child.